and welcome to the Dr. Bob Show. We've got a very important show for you in the next 30 minutes. We're going to be talking about a disease called a silent killer. Why is it a silent killer? And over 25% of the population has it. By age 60, if you live to age 60, 90% chance you'll have it. Yes, it's hypertension, it's high blood pressure. What are the causes? How do you know if you have the diagnosis? If you've ever had one blood pressure elevation, does that mean you need treatment? My guest is Dr. Mike Bernard. Dr. Bernard is a board-certified internal medicine specialist, and he'll be answering our questions. He discusses high blood pressure with his patients every day. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about type 2 diabetes. What are the symptoms? How do you make the diagnosis? And how do you know if you have it? And food allergies, new treatment for food allergies, peanut allergies. Can you desensitize to foods? It's been done. We'll talk about it. We're talking with Dr. Michael Bernard, board-certified internal medicine specialist, and we'll be talking about that silent killer, high blood pressure. Mike, welcome to the Dr. Bob Show.
Thanks, glad to be here.
Why do they call high blood pressure a silent killer?
Well, no one really feels hypertension, high blood pressure, and it takes its effect over years, and the next thing you know, you're having a heart attack, stroke, kidney failure, heart failure.
So people don't have symptoms with high blood pressure?
Usually not.
You know, I've had a lot of people say, I know when my blood pressure's up, and they really, really don't.
That's right.
How does it cause stroke?
Okay, well, the way the blood pressure affects the blood vessels, it can occur in two different ways. It can either cause blood vessel damage, which then leads to blood clots, and those can go to the brain, or it can cause smaller blood type vessel damage, which then causes bleeding in the brain. And that's a stroke. You don't want that.
No, I don't want that at all. How about heart failure? How does high blood pressure cause heart failure?
Well, the heart's a pump. And you can imagine if you had a pump in your yard that was just constantly on, under constant pressure, eventually the pump wears out. The same effect happens to the heart. When you have high blood pressure, you're putting the heart under a lot of strain, and eventually it just wears out and enlarges, and it starts to fail.
Now that's heart failure, so the heart sort of gets tired of pumping all that time?
It gets tired.
Hey, how about heart attacks then?
So,
how does it cause a heart attack?
Well, high blood pressure affects the lining of the blood vessels, which then causes platelets to congregate inside that blood vessel, along with cholesterol, cuts off blood flow to your heart, then you lose part of your heart. That's a heart attack.
Don't want to have that either.
And that's a bad thing.
So you don't want to have a stroke, and you don't want to have heart failure, and you don't want to have heart attacks. Tell me, what is high blood pressure? What are the numbers, and why do people, how do you get those numbers?
Well, the way those numbers came about is we just looked at people's blood pressures versus their risk of dying from a heart attack or a stroke. And we found that for the vast majority of people, their blood pressure should be less than 120 over 70. And then as you start to double as you start to increase your high blood pressure, the top number called the systolic blood pressure.
That's the systolic.
That's
the
right.
One. Should be 120. You want it 120.
120. So once it gets to 140, every time it goes up by 20 points, your risk doubles.
Whoa.
Your risk of having a heart attack or stroke doubles. The bottom number, the diastolic blood pressure, every time it goes up 10 points, your risk doubles. So top number 20 is doubling. The bottom number diastolic, every time it goes up 10, your risk doubles.
Let's talk about that big number, the top number. Normal would be 120. If it goes up to 140, if it's 139, what do you call that? 120 to 139?
Well, that's a pre-hypertension state, and it's really not normal blood pressure. It's high blood pressure. Hypertension, the diagnosis is above 140. for systolic. But it's still not, 139 is not normal. You need to be
135?
135 is not normal.
132?
That's right. You're getting better.
Well, so when you start getting a little systolic blood pressure over 120, then you start being concerned about it. How about that lower number? You said it's over 70. So if it goes up 10 points, you double your risk.
That's right.
How about 85? Is that real bad?
At 85, you're in that pre-hypertensive state, so elevated blood pressure. And those are the steps, when you're in that pre-hypertensive state, you really want to be working on diet, exercise, lifestyle changes, trying to become a healthier person.
It would seem like that might be the most important time to really start attacking blood pressure health is when they're in the pre-hypertension stage. How do you make that diagnosis? You take somebody's blood pressure. I always hear about white coat syndrome. The only time my blood pressure is high when I'm at the doctor's office. What about that?
Well, people have anxiety for various reasons, and when they come to the doctor's office, a lot of times their blood pressure goes up. They're worried we're going to tell them something's wrong. And so it's important that we have more than just one reading of an elevated blood pressure, generally 3 elevated readings. And we want to make sure that they've checked it at home with their own monitor in a relaxed setting so that we're correlating what we get at home with what we get in the office.
Do you find that the blood pressure cuffs at home are pretty good?
They are. They've come around a lot.
Yeah,
a long way.
I've got one right here, and every time you turn this on, it sort of calibrates itself. And so it really does a good job on that. We'll talk about it later. Do you like this type home blood pressure cuff?
I do.
How about one on the wrist or one on the finger or one on the fingernail?
Well, previously we tell people, look, the ones on the wrist are not that accurate, but they're actually fairly accurate. And Consumer Reports had a great review of them recently, and they showed that the home monitoring kits are very accurate.
Are they expensive?
No, they're inexpensive. $50, $60 will give you a good quality machine.
So if somebody's had an elevated blood pressure even the first time, do you have them get a blood pressure cone, or 2 times or 3 times?
I think it's a good thing for people to have at home. It's a good way to monitor their symptoms and their overall health. So generally I find if somebody has 2 elevated blood pressure readings, I tell them to go ahead and get their cuff.
Okay. And when they come back to you, do you tell them just to take it and come back and tell you, or have them write it down?
I have them write it down. Check your blood pressure, wait 5 minutes, check it again, make sure it's in a relaxed setting, write it down. I have them do it 3 times a week for 2 weeks, and then they bring the records back in.
Morning or nighttime?
So I generally have them do it at the same time in the morning. It's going to be the highest time of the day when your blood pressure tends to go up for most people at the highest in the morning. But all times of the day are important, but generally the morning.
Well, I would think after you've been working all day and everything, your blood pressure would be higher in the afternoon. It's higher first thing in the morning.
First thing in the morning.
So,
those hormones telling you it's time to get up and go.
Time to get up and go.
That's
and get
right.
with it, and the blood pressure goes high. So if somebody comes back to you and their blood pressure's been averaging 145 over 92, time to start treating?
You need to start treating with diet and exercise, making sure you're eating a very healthy diet and really being very aggressive on exercise. If you've already done that, if you're already exercising 30 minutes most days, if you're already on a healthy diet, lots of fruits, lots of grain, fiber type.
How about salt in the diet? How about a DASH diet? That's a diet against systolic hypertension. Is that a good diet?
Yeah, well, it's supposed to be the best one. U.S. News and World Report rated all the different diets, and they said, look, this is the best diet.
For high blood pressure?
For high blood pressure, and the government, I guess, has done a fair amount of studies on this diet. They're the ones who promoted it, and it tends to work.
So that's capital D, capital A, capital S, capital H. Google it. You Google DASH diet, it'll cut down on your sodium. Why do we want to cut down on sodium?
Well, it helps decrease the amount of volume of fluid in the blood system, which decreases the pressure. So.
If I had a little borderline high blood pressure and I went on a DASH diet and started exercising, would you expect my blood pressure to come down?
You would. You'd expect it to come down as much as some medications bring it down.
If it doesn't come down, are there good medicines?
There's great medications now.
And that's what we're going to be talking about when we come back, a little bit more about lifestyle changes. But let's see what a home blood pressure cuff is really like. If your doctor tells you you have high blood pressure, whether it's 1 time, 2 times, or 22 times, the best thing you can do to help your doctor is to get a home blood pressure monitor. You can get them at any drugstore. They self-calibrate. It's a digital read-off, so you push a button and just sit there and wait till you get your blood pressure recording. Then you write it down and you take the results to your doctor. You do it every day. You can do it morning and night. Take it twice a day. Now, your feet should be together. You should sit up. Your arms should be at heart height. And then you simply push the little button. It says it's calibrating right now, and we'll be able to listen carefully here. I can hear the motor as it's beginning to pump up the pressure on the cuff. So it'll put up the pressure high and then drop it down, and it will get my systolic and my diastolic blood pressure. So let's see what it does. It cuts off, now it's dropping the pressure down, and I'll soon have my digital readout that I can copy down and then take to my doctor. It will help him immensely, and it will help you control your blood pressure. Here's my blood pressure. We're talking with Dr. Michael Bernard, board-certified internal medicine specialist, about that silent killer, high blood pressure, hypertension, normal 120/70. Both numbers important. If they go up too high, increases the incidence of heart attacks, stroke, heart failure. You don't want any of those things, so you want your blood pressure diagnosed. If you diagnose it, you need to have a blood pressure monitor at home so you can tell the doctor what your blood pressure is like at home. And is that pretty good synopsis of what we talked about?
I think so.
Okay,
Yes.
let's talk about medications. Are there different medications that help people?
No, absolutely. There's a lot of different classes of hypertension medications, and they really have advanced over the last several years to where people don't have the side effects that maybe you heard your parents and your grandparents talking about.
So what would be the first line? Let's just say somebody that's 50 years of age and first time they've had high blood pressure, and they work hard and they're a little nervous and a little overweight and they've exercised and dieted. How would you treat, what medicine would you pick?
Well, the consensus papers, where all the experts get together, they say you ought to start with a diuretic. And diuretics are inexpensive. Most people can't tell they're taking it. When you hear about diuretic, you think, boy, am I going to be going to the bathroom all the time. They're really very low doses, and so they're very inexpensive, they're very safe, and they're very effective.
What's the name of some? Is that like a thiazide or?
That's right, hydrochlorothiazide,
Chlorthalidone?
chlorthalidone.
All of those. Now, their purpose is to get rid of water or get rid of salt or both?
Get rid of salt, and then the water follows the salt.
Okay. So how long do you have a patient on a diuretic before you decide, it doesn't seem to be working good enough?
Yeah, 4 to 6 weeks.
Okay.
So,
If the blood pressure hasn't gotten well, if it's gotten well, you keep them on that medicine?
generally keep them on the medication if they've seen some effect with the medication.
How long do you keep them on it?
So, well, when you've already done your other stuff, you generally are on blood pressure medications for life.
How about if somebody comes in and they're really overweight, they're 50 pounds overweight and very stressful job and they're not eating well and their blood pressure doesn't go down, and they suddenly realize they better lose weight and better eat right, and their blood pressure sort of comes down. Can you take them off that sometimes?
Well, if you've done the right stuff, if you've decided, look, I've decided I'm going to be a healthy person, I'm going to eat right, and you're lost weight, absolutely. And that's one of the reasons that you need to monitor your blood pressure at home, and also that you need to come back in for follow-up, because if you do make those lifestyle changes to get your blood pressure down, absolutely you can come off the medications.
The next step up, if the diuretic doesn't help, do you add something on, or do you stop that and put on another medication? What do you use?
Generally, we add something on. The ACE inhibitors are very, very popular category medication. They have a lot of very good effects on the heart and the kidneys.
Yeah, people with diabetes, is that the one almost a drug of choice if they've got high blood pressure?
If you have certain disease states like diabetes, it's absolutely the first line medication. You want to use that because it's going to help protect your kidneys, which unfortunately in diabetes your kidneys tend to fail, and so it helps protect your kidneys from disease in the future.
So it's a good. Those are ACE inhibitors. Got name of some?
Lisinopril, captopril.
Okay, so there's a lot of those, and they have side effects.
They do. The biggest one's a cough. You probably see that in your
Yeah,
practice.
you see a lot of people with just a dry, relentless cough. They just cough their head off, and all they do is have to stop that medication.
That's right.
Is that correct?
It goes away completely.
And then they can get swelling of the lip and swelling of an eye.
Angioedema, yeah, very rare, but certainly we see it.
Okay, and you look for it, you know it's there, and they would just have to take it. It's stopped.
And
go
if
to
you have
something.
that, you'll know it.
As
So you'll be getting attention soon.
Okay, so you've added an ACE inhibitor onto a diuretic. Pretty good chance your blood pressure is going to be under good control.
They work very well together. They're synergistic. They work on top of each other.
Do you increase the doses of those before you add a third medication?
Generally, we do. So generally, we try to, especially if you have diabetes, we want to maximize the use of that ACE inhibitor. It helps protect the kidneys.
Yeah, I like the way you say most of the time because every patient is different. aren't they?
Absolutely.
You know, and that's the nice part about medicine. It's not
The art of medicine.
the art of medicine. That's right. So another class. We've got diuretics. We've got ACE inhibitors. What's this, another class?
Well, we use beta blockers, especially in patients who have heart disease.
What does a beta blocker do to high blood pressure?
So a beta blocker slows the heart rate down, but it also causes the blood vessels to dilate, to relax.
I usually call it like WD-40 for the blood vessels, and the heart doesn't have to work as hard. Is that a pretty good analogy?
That's right.
For an
Kind of
allergist.
turns everything down a little bit. So,
Side effects of a beta blocker?
well, you can have shortness of breath. You can have some feelings of being just a little too mellow, maybe just a little slower than you normally run.
And it will speed up your heart rate or slow down your heart rate?
Slows down your heart rate.
And so if you need to exercise, does your rate come up?
It does come up, but maybe not quite as much as it used to.
Okay. So now we've got a diuretic, we've got an ACE inhibitor. What's an ACE receptor blocker?
The good old ARBs, the angiotensin receptor blockers were very similar in nature to the ACE inhibitors, except they have one big advantage. They don't have that nasty cough.
Yeah, so if somebody has an ACE inhibitor and they get a cough, then you can put them on a ACE receptor blocker and maybe the cough will go away.
Usually it goes away, and
That's pretty good.
very few side effects with the angiotensin receptor blockers.
Beta blocker is pretty good.
Great medication, especially if you have heart disease.
Can they bother people with asthma, for instance?
They do. They cause bronchospasm.
You know, we see a lot of asthma in my practice, and I find that the old-time beta blockers really bothered asthma. The newer ones really...
Well, the newer ones, people don't complain about the side effects.
Yeah, they're really pretty good.
They are.
Any other class?
Well, calcium channel blockers.
Good medicines?
Good medicines. A lot of people have heard of Norvasc. They work very well. Norvasc is one that doesn't affect the heart rate at all, and side effects are minimal, maybe just a little ankle swelling. It causes the blood vessels to dilate, and you get a little pooling of fluid around the ankles in about 1 out of 10 people. So it's not a lot of people, but
We forgot to mention the side effects of the diuretics initially. The diuretics can cause one very important thing on a side effect.
well, lightheadedness is one, and then also, if you're, especially as you get older, you don't want to take the diuretic at night because you have to get up, use the bathroom at night, it causes lightheadedness, and you don't want to fall.
How about potassium loss?
Potassium is a big issue in diuretics because it drives them low, so we need to make sure we're eating a healthy diet full of potassium for diuretics. And then with the ACE inhibitors and the ARBs, it can actually cause your potassium levels to go high, which again, those are reasons where you want to continue to follow up with your physician and make sure that you're getting the right amount of potassium in your
How
diet.
often should you revisit your doctor if you've got high blood pressure?
Well, initially it should be on a 3-month basis, if things are going well, you may be able to convince your doctor to come in less often.
Good medicines, good control. Must be fun, help people not have that silent killer waiting to attack since you can control it. Mike Bernard, you're a great teacher. Thank you for coming to the Dr. Bob Show. Thank you for teaching us on high blood pressure and the importance of the treatment.
Well, thank you. Glad to be here.
Great show. If you have high blood pressure or if you haven't checked your blood pressure, you get it checked. If you have high blood pressure, you get it treated. And now we're going to be spending some time talking about how do I know if I've got diabetes and food allergies? Can desensitizing work? Well, there's some new news out. Could be. I want to thank Dr. Michael Bernard. Excellent discussion on hypertension. Be sure you get your blood pressure checked, and if it's high, get it treated. And now for questions from you, the viewer, that I think will be important to your health. Question number one, Dr. Bob. What are the symptoms of diabetes? How do I know if I've got diabetes? Excellent question. There are some classic symptoms of people that have diabetes. I saw a person the other day who was eating a lot of food and yet they were losing weight. The problem with diabetes is this: the blood sugar goes high. It goes down to the kidneys. The kidneys try and preserve the sugar so we'll have energy, but it gets too high, and so urine begins to spill out blood sugar. So you get sugar in the urine. When that happens, the sugar pulls out water. So we have a lot of frequent urination. That's called polyuria. We're eating a lot of food because the sugar that's in the bloodstream is not being used, so we're hungry. So that's polyphagia. Polyphagia, polyuria. We urinate so much that we have to drink a lot of water. Instead of 6 or 8 glasses of water, we're drinking 10 or 12. So eat a lot, drink a lot, urinate a lot, and losing weight and no energy, you need to be sure that you get checked for diabetes. With type 2 diabetes, there's an increased incidence of people becoming obese, and when people get obese, the insulin doesn't work as well. Now, how do you know? How's the diagnosis made? Well, if your blood sugar is greater than 126 fasting, then you have diabetes. If the best blood test would be hemoglobin A1C. It will measure your blood sugar over a 3-month period. So one stick, it'll give the doctor an idea of how your blood sugar has been over the last 3 months. That means that you can't cheat and eat right before you go to the doctor. He'll get an accurate picture. If you've got diabetes, you've got to get it treated. The incidence of blindness increases with diabetes, of chronic kidney failure increases with diabetes, amputation increases with diabetes, and so heart attacks increase with diabetes. If you've got diabetes, pay attention to it, start losing weight, do what your doctor says, get on the right medications. Question number 2, Dr. Bob, why is obstructive sleep apnea so dangerous? People that snore, when they snore, the back of the throat can fall back against itself, and we actually stop breathing 10 seconds, sometimes 15 seconds, up to 30 seconds. People can actually stop breathing. When that happens, the oxygen level goes low in the bloodstream. When that happens, the heart can become very irritable. It's not getting enough oxygen, especially if there's some heart problems. So you can get heart arrhythmias, you can get heart attacks. Actually, people with obstructive sleep apnea, for some reason, there seems to be a resistance to insulin. And so it increases the incidence of getting type 2 diabetes. There is also some hormonal changes when people have obstructive sleep apnea that also will change their blood pressure. Now, when you're not breathing at nighttime, the brain says, wake up, and it tells the kidneys to put out adrenal hormones, and adrenal hormones will make your blood pressure go up. That with the low oxygen, heart arrhythmias. Bottom line is, if you snore, and you snore habitually, there's a reasonable chance that you've got obstructive sleep apnea. Be sure that the person in bed or somebody watches you as you sleep if you snore, and make sure that you don't stop breathing and wake up with jerks. If so, it could be a life-threatening situation. You need to see a sleep specialist. When you see a sleep specialist, he'll be able to put you on the right program where hopefully your obstructive sleep apnea can be treated successfully. Treatment's very good. Sleep specialists are excellent. We usually end up having to have a CPAP, but there can be other things that we can do. Lose weight, for instance. Be sure that nasal obstruction is corrected. Well, it's all the time that we have for this show. I hope you've enjoyed it as much as I have. Remember, we've got to be exercising. If we exercise, we lose weight. If we lose weight, we don't have as much problems with snoring. We don't have as much problems with high blood pressure. So if we exercise, it reduces stress, lowers blood pressure, makes us feel better. It puts out hormones that makes us happier. Eating properly, and that simply means better foods. More fruits, more vegetables, more fish, more chicken, more baked foods, no fried foods, no red meats, nothing that's bad for you. 8 hours of sleep? Boy, will you feel good. And doesn't it feel good to have 8 hours of sleep? If you're not sleeping well, talk that over with your doctor. And most of all, what is it we like in the Dr. Bob Show? It's that laughter in your life. You know, it's so important to laugh. Read funny stories, read the comic books, talk over with friends of yours, tell old stories, laugh a lot, start giggling, and sure enough, you'll stay healthy.